All right, if you're a nursing student, you know the feeling, the NCLEX. It feels like the final boss, right? It's stressful, it's a huge challenge, and it seems like you have to know absolutely everything. But what if I told you there's a way to study smarter, not just harder? What if you could use the test maker's own game plan against them? Well, today, that's exactly what we're going to do. We're cracking open the official blueprint to give you a real strategic advantage. Because here's the secret. That playbook, it actually exists. It's called the NCLEX-RN Test Plan. Now, I know what you're thinking. Sounds like some dense, super boring document. But trust me, you need to start thinking of this as the official blueprint. It literally tells you what's going to be on the exam, how much of it, and what they expect you to know. It is the ultimate study guide, and it's been hiding in plain sight this whole time. So here's our game plan. We're going to dissect that blueprint. First, we'll get a handle on the 4 main pillars that the entire exam is built on. Then, we're going to put a big spotlight on one of the most critical areas, safety and infection control. I'm even going to give you a literal checklist of what to know. And finally, we'll talk about why all this matters way beyond just passing the test. All right, let's get into it. Okay, first things first, you've got to understand how this test is built. The entire NCLEX is structured around 4 major categories, and they're called client needs. Every single question they can throw at you, whether it's about pharmacology, patient communication, you name it, it's going to fall into one of these 4 pillars. And when you look at the breakdown, you'll notice right away, they are not all created equal. Physiological integrity is the big one, the absolute monster. It could be up to 63% of your entire exam. But hang on, look at that first category, safe and effective care environment. It can be worth up to 37% of your test. That is a massive piece of the pie. And inside that huge category is the exact topic we're going to zero in on today. So let's take out our magnifying glass. We're zooming into that big, safe and effective care environment pillar and focusing on a subcategory that is absolutely essential, safety and infection control. This stuff is one of the non-negotiable foundations of being a safe nurse. And here's the official definition, straight from the test plan itself. See? It's not just about washing your hands or wearing gloves. It's about this whole comprehensive system of protecting everyone, your patients, your coworkers, and you, from any hazard you could possibly find in a healthcare setting. The key takeaway here is that its scope is incredibly broad. And this number is exactly why we're talking about this today. This one single subcategory makes up 10 to 16% of your entire NCLEX. Let that sink in for a second. You could get more questions on this one topic than on all of health promotion or psychosocial integrity combined. So yeah, mastering this isn't just a good idea, it's a total strategic necessity. So how do you master it? This is the best part. The test plan doesn't just name the topic and leave you hanging. It gives you a to-do list. Seriously, they call them related activity statements, but what they really are is a checklist of the exact skills the NCLEX is going to test you on. Let's look at the first part of this checklist. It's all about the core principles. And you know what's really important here? The verbs. Look at the action words. Apply, assess, promote, protect. They're not going to ask you to just define aseptic technique. They want to know if you can apply it in a real situation. Can you assess a room for risks? This is all about active, on-your-feet critical thinking nursing. Okay, part 2 of the checklist gets into the real nuts and bolts of what you'll be doing every day. Can you follow the right procedures for biohazardous waste? Can you make sure equipment is being used safely? This isn't just about knowing the rules in a textbook, it's about executing them perfectly, every single time, whether you're dealing with restraints or following a security plan to keep a newborn safe. And this final part of the checklist, this is where your role gets even bigger. It's not just about what you do, it's about communication and accountability. You have to be able to educate people. You have to be professional enough to acknowledge and document your own mistakes or near misses. And maybe toughest of all, you have to have the courage to report, intervene, and escalate when you see someone else doing something unsafe. This is about protecting the entire system of care. Okay, so we've torn apart the blueprint, we've got our study checklist, but before we wrap up, it is so important to take a step back and see the real mission behind all this. This isn't just about jumping through hoops to pass a test. Think about it. Every single item on that checklist, every percentage point in that test plan, it maps directly to something you absolutely need to know to be a safe, effective nurse on day 1 of your job. So when you study these things, you're not just memorizing facts for an exam. You are internalizing the fundamental skills of the professional you're about to become. The NCLEX only exists for one reason, and that's public protection. Its whole purpose is to make sure that any nurse with a new license has the basic competency to provide safe care. So mastering these concepts isn't just about getting that license. It's about earning the incredible trust that patients and their families are going to place in you. So the next time you sit down for a study session, don't just open a textbook to a random page. Pull up the test plan. Use this checklist. Focus your precious energy where you know it's going to have the most impact. You literally have the official playbook in your hands now. So the only question left is, how is this blueprint going to change your very next study session?